It's been exactly 3 weeks since Omicron was first reported in South Africa, and I came here and told us that we will be having an update from 3 weeks. That is when we will get an update on how the scientists have found out or what is going on, and all that about the studies about Omicron variant. Okay. So welcome to our YouTube channel. My name is Eti at Nashville, and here we discuss health, we discuss lifestyle, we discuss current affairs, and just getting informed here and there. And today we are getting an update on Omicron. So in Kenya, we have 3 reported cases according to our CS Mutahi Kagwe. He gave us that report today, and these are cases that were found in arrivals who are coming in from other countries, and it has not been disclosed which exact countries they were coming from, but there were 3 arrivals, okay, and they have been quarantined. So we are not so worried about it, but we're still insisting on taking the necessary measures too. Worldwide, the WHO gave an announcement, an update at around 12 hours ago, that we have 77 countries that have reported Omicron variants, and other countries, we're expecting that other countries that have not reported, it doesn't mean that it's not there, but due to how it spreads very fast, we are expecting that it's more than 77 countries. Okay, so on the update is how people have taken Omicron to be mild than Delta, and the WHO was stating clearly that that is not the case. The transmissibility rate of Omicron is very high compared to Delta, and we should not get very comfortable around it because we have not determined. It is very early in the disease for us to determine its virulence, how severe of a disease it can cause. Okay, so the only advice they said that as much as the countries and people have been vaccinated, that is not enough to stop the Omicron or any other variants. What we need to do, we have to go hand in hand with other health advisories that the countries has put in place, WHO and the Ministry of Health advisories. That is washing your hands, preventing social gathering, putting on your masks properly, and sanitizing. Okay, all those things have been put across, and we know in the public, it's in the public eye. Okay, the other thing, number 2, is the need. Is there a need for booster? Does the booster dose work, or do we need to have a booster? Yeah, the answer is currently we are focusing on having people getting the primary immunization doses, which is apparently determined to be at 70% preventive. So it is good news actually, because when we got into Omicron, we were not very sure if the vaccines that we've received will cover, but being given percentage of 70%, it is way above what we are envisioning, and that is a good report. So you'd rather get the primary dose, and definitely it is the country's discretion to determine whether its citizens will need a booster dose, and there are other countries that have already started giving booster doses, and that is also a worry because there will be an issue of hoarding of the vaccines for the countries that have already received the 2 doses, primary doses. So we are focusing, the WHO is advising focus on primary vaccination first. Okay, and statistics according to WHO says that at least 51 countries have less than 10% immunization rate, vaccination rate, and 98 countries have less than 40% vaccination rate. That is primary vaccination rates. So this is what we are supposed to be working on, and not thinking about booster doses. Okay. The other thing is the reinfection rate. When Omicron first hit, it was known that it has higher reinfection rate. The higher reinfection rate is basically because of its high transmissibility, and also its ability to evade the antibodies that you've already created in your system, immunization, or due to primary disease exposure. So the Omicron has been noted to evade these antibodies and get you infected. So they're still working on, they have the 13 studies to look at and to determine what to do around it and why and how it is behaving. So we still have some more updates that should be coming in, and there's a report from the researchers that will come out tomorrow, and I will try and track it down and give us the updates. That's why I'm here. Okay, so we will get the first-hand information once it hits the screen. All right, kudos to UK. Thank you very much for lifting the travel bans for South African countries and other African countries that had been banned from getting to the UK, and we are hoping that even US is going to lift its bans, because it doesn't make any sense. Omicron is not in Africa alone, so it doesn't make any sense for you to ban African and South African countries from visiting your territories because of whatever reason, yet Omicron is everywhere. This is the mistake we did with China, and it should not repeat itself. So it's just a nudge to other countries. Please don't ban people from traveling, not unless they meet your criteria, maybe vaccination or PCR test, but it doesn't make any sense banning anyone from visiting your country. All right, that is all from me for today, and I'm hoping to give us an update tomorrow. Keep watching, keep subscribing, keep sharing. Let us share information. Information is power. Zeti here, and it's bye for now.